Hi, this is Trisha from Tribe to Village. This is our tribe, our village, our family. And today we're joined by the wonderful India-Rae McKenzie. Hi, India.
Hi.
India is an advocate for health and wellness. She's constantly encouraging people to live their best and healthy life. And today she's sharing with us her experience with acupuncture. Thank you for that, India.
No problem.
Now, if you guys are anything like me, you don't know much about it. So India, I think that acupuncture is being stabbed repeatedly over and over again with needles in the name of health.
Yes and no. So they are teeny tiny needles. You barely feel them. But your acupuncturist, who would be licensed, is their study is based on Chinese medicine. And so everybody has acupoints, and they use these tiny needles to kind of hit these points to either open up or help your body into better health.
Okay, so better health in terms of physical health or emotional? Physical,
mental, emotional, all of the above. So that's the beauty, as I've in my journey have learned with acupuncture. I started going because I don't sleep. I'm like an insomniac. I sleep 3 hours a night and think that's okay. And as I'm getting older, I'm realizing this is not easy.
That's not okay.
It is not okay. And so I started seeing a friend who discussed some of the issues that I was having. When I first started seeing her, it was really mainly for the insomnia, but there's a lot of stress, a lot of anxiety. I had knee pain, terrible knee pain, and things just weren't getting better with just physical therapy. So after 3 weeks, actually, after I quit physical therapy, between acupuncture and seeing a chiropractor, I'm 98% better.
Oh, wow. So you see an acupuncturist and a chiropractor.
I see an acupuncturist and a chiropractor.
Okay, and that helped with your pain and stress?
Specifically knee pain, that pretty much eliminated it. But for stress and sleep, which is obviously they're tied together, it's a tremendous help. I get tired by 11 o'clock at night and actually sleep through the entire night. It's great.
Wow.
Yeah.
So how you said that you went to physical therapy and all of that. So I want to know, did the doctor mention anything about acupuncture, or was that something that you found? Like you said, you just went to your friend on your own without medical encouragement.
So I was in physical therapy for about, I was actually in there before surgery for 6 months, and it wasn't much progression. Then I went to surgery. I had a meniscal tear and some early arthritis in my right knee. And so nothing was getting better. And then after surgery, I was in physical therapy for 4 months, and then COVID hit. So I ended up I didn't quit on purpose. I quit because nothing was really open. And then I started seeing my acupuncturist again, and I was like, I'm having just severe knee pain, and I'm trying to do the exercises that they were telling me to do. And it's just repetitive, and nothing seems to be getting better. So then we focused mainly on pain, and that helped. So when I mentioned this back at the doctor, I said, I'm interested in going to acupuncturist to try and help with the pain. And he was like, that's a great idea. Go ahead, try it out. Let me know how it goes. And I went back and told him, I was like, this is great. I feel so much better.
Wow. So walk us through an acupuncture session. So you walk in, what happens?
So when I walk in, like any office, regular COVID protocols, check temperature. Also, I'll say I have back pain. We'll do back pain. We'll do knee pain. It depends on what's a flare up of that day. Okay. After she does the questions, the weekly questions. She, you know, lay on the table. Depending on the season, it's a heated table or not, and which is really nice. And then she wipes down with alcohol just to kind of clean the area to make sure nothing gets infected or anything like that. And then from there, she hits points. She hits the points. I will leave all that explanation to an acupuncturist if you're interested in one, but they hit the points that are necessary for why you're there. I can tell you the experience from some of them, depending on the situation. I get really bad period cramps, and so I'll be treated for cramps. And depending on where I am in my cycle, sometimes they bleed, which is normal. And so some people may be alarmed, some people may not, but it's a normal cycle. And I can tell you, no cramps afterwards.
Wait a minute. Wait, we need to talk about that one.
Yeah.
So is the relief instant?
It's
or do you have to wait some time?
I believe it's different for everybody. So I know for sometimes when she does, I think it's called like the crown for sleep, I'm actually quite tired for the rest of the day, and that night I just knock out. For the knee pain, it wasn't instant. It was over the course of like 3 weeks, I started feeling a difference. And then after about 3 months after joining in chiropractor, it was like instant relief. Wow. Barely any knee pain.
Day and night, huh?
Yeah.
I love this because it shows that there are different options to healing.
Yes.
And you should always consult with your doctor.
You should always consult with your doctor. I will personally say though, some doctors believe in it, some doctors don't. So seeing a medical professional will have their professional opinion, and that's exactly what that is. But
yeah, so you would encourage this as a part of your overall
health journey.
Routine. Yes.
As your overall health journey. I think it's important for people to actually just try it out if you're at all curious. Like I said, they treat hundreds of problems for hundreds of years. So and it's pretty painless. You don't feel anything.
Really? I wouldn't think that having needles would be painless, but glad to know.
The needles are painless sometimes. I'm not going to go into detail, but sometimes your chi, things are off balance and you'll feel different feelings, but it's never really pain. You should definitely see a licensed acupuncturist.
Yes, that's very important to do your research because they would also know if anything is contraindicated. Like say, for instance, you have some type of bleeding disorder, or do your due diligence.
So, fun thing about acupuncture, I'm pretty sure they treat almost anything and everything. I do know a lot of people actually reach out to acupuncturists for infertility issues. And I've heard that has worked as well. Personally have not been going for that, but I've heard of that, and a lot of people have had success with that. And once again, it's the advice of your medical professional.
Yeah. So India, I have like this pain back here that I carry, but I think it's like pain from stress that's held in the body. So would I be a good candidate for acupuncture?
I would say you're definitely a good candidate for acupuncture. Maybe acupuncture, maybe a little bit of cupping to kind of release some of that tension. I suffer from the same issues. I held a lot of stress and anger in my shoulders, in my back.
Yeah, and you walk around like this.
Yep. You're always on guard. So you're just like, built up. But, it's, depending on your acupuncturist as well, they do provide like cupping, which is also like Chinese medicine, using a glass cup. They suck the air out and it kind of just sucks all of your all the toxins to the surface of the skin.
Interesting. And just for like, just to know, is this covered by insurance?
So
usually out of pocket?
No. So here's the fun fact, actually. Some practices are in network with insurance companies. So personally, my insurance company, she's out of my acupuncturist out of network for my insurance. But when you submit it, they reimburse you. It's not the full amount, but it's like 75%. So it's not all out of pocket.
That's good to know.
So a lot of acupuncturists are in networks with some insurance companies. So that's definitely something you should ask or look into before you book your appointment. But that's a great thing. That's a great question.
Oh, thank you so much, India. So India, I know that you said that your knee pain is like pretty much gone. So do you still see your acupuncturist, or do you kind of like, okay, I'm healed now, I can take a break? And
I still see my acupuncturist. I pretty much go once a week or every other week. And it's really based on, I'll treat the knee pain intermittently if it flares up. But I mainly go, it's on how I feel if I'm not sleeping well, or if I see more stress, or things are coming up and I feel like I need a little bit of a release, then, I book that appointment.
Okay. And do they give you tools to maintain your feeling at home outside of the office? So
one of the benefits of an licensed acupuncturist is that, yes, they can offer some advice or medications to kind of help. So I had this strange rash that popped up on my arm the other day, and I was like, I don't know what this is. It just itches. I don't know where it came from. I did go to the doctor. They suggested steroids. I try to stay away from taking strong medications such as steroids and stuff like that. And she was like, oh, we can do points and try to help that out. And she gave me, it's all natural, 100% organic salve, like a cream. And it was gone in 2 days.
Oh, wow. Wow.
So,
well, India, thank you so much. Is there anything that you want to share with someone who's a little bit skeptical about acupuncture?
Well, don't let me do all the talking. You can always, I know my acupuncturist will book like a free 15-minute consult, and she can talk to you about that, some about your problems, some about how acupuncture works. And I'm sure other acupuncturists do that as well, just to kind of get you comfortable with being able to do it. But I know I have a couple friends I've referred that are afraid of needles, and they're like, I don't even feel anything. I feel great. So it's just to say it's worth a try, Go in and find out your information.
And then leave a comment and let us know how your experience went.
Yes, please. Actually, I would be glad to hear.
Yes, and I will definitely include India-Rae's acupuncturist information in the description in case you're interested. India, thank you so much for joining us and for sharing your experience. Thank you so much.
No problem. Have a great night.
Yes, let's continue to elevate and grow together. Please like, comment, share. Don't forget to hit that notification button so you never miss a video from Tribe to Village. Until next time, bye.
Bye.